if you ask any client who has struggled with addiction, they're going to go, yeah, of course, right? Like, duh. Of course, it feels dissociative when you have an urge or when you go into the addictive sort of process. But I don't think that in the field we've really talked about it as such or thought about it as such. But essentially, what Adam O'Brien is sort of describing is that there's unprocessed trauma, which has layers of dissociation. And then that dissociative experience can lead to substance use or process behaviors. And then that's a dissociative experience also that creates these intrusive dissociative responses, especially when the world gets too overwhelming. So I would describe addiction or the urge to use like the urge to dissociate from something that's really uncomfortable, right? And these urges can be, really have a very dissociative quality. Like 1 minute you were okay and you're doing what you're doing, and then the thought comes in, and then the next thing you know is you're having preoccupation and sort of going into this urge or dissociative response. It's very brainstem, it's very survival oriented, and accesses and taps into those areas of the brain. So it's hard to reach and hard to treat because of that, or can be anyway. So correlations between trauma and addiction, they go hand in hand. High correlations. There's been, plenty of studies that have looked at this. Trauma creates physical, mental, cognitive, and spiritual vulnerabilities. So it increases the risk for mental illness, physical illness, and substance use. And approximately 75% of those with substance use conditions or disorder, I don't like using that word because I find it pathologizing. So substance use adaptations report a history of trauma. In my real world experience, I found that number to be higher. So high correlations with those who have substance use or process addictions, experiencing a form or multiple forms of trauma in their lives. ACEs are often common in those with substance use adaptations or process addictions. And just some of the numbers here, if you have one adverse childhood experience, there's at least 4 times more likely a risk to develop substance use disorder. And those who have 4 or more ACEs have 12 times more likelihood to develop some kind of substance use condition as well. So we can see that, the more trauma someone has, the more their brain and body is going to be looking for things to self-soothe. And that makes total sense. So the ACE studies implore us to understand this connection between developmental trauma and addictions. Some of the limitations, I believe, of that study is that it really only looked at, white socioeconomically middle class people. So not looking at, other marginalized communities as well. And also understanding the why, right? The socioeconomic and cultural collective sort of conditions that contribute to people developing these addictions. And most individuals who have developmental trauma and addiction have a few things in common.